All right, we're going to try this again. Sorry for the little technical issues there with my camera. This is Ask Dr. Geier Live on Friday, February 18th. I apologize for whatever just happened with the camera. I was sitting there talking and there was no picture of me, so I apologize that. My name is Dr. David Geier, double board certified orthopedic surgeon, sports medicine specialist, and media medical expert. Wherever you're watching, wherever you're listening, hope you're making today your masterpiece, because my goal of doing this Ask Dr. Geier Live is I want to help you feel and perform your best regardless of age, injury, or medical condition. So hopefully I'm going to give a couple minutes because again of the technical issues, and now it's not in the one that the video that everybody clicked the link to, and I apologize for that. Jamie says it's all good. I appreciate it. I for the life of me, I have no idea what happened. I have this TV studio in my house because I do the daily segments on the ABC station here and the Fox station here, and I always just turn it on and there it goes. And all of a sudden this time I turned it on and I'm talking, I'm looking at the camera's on, no picture of me in the thing, so I don't know what happened. So this is going to be, I've done Ask Dr. Geier Lives in the past on Friday, noon p.m. Eastern time, but not terribly regularly. That's been kind of a challenge with clinic schedules and various things, but that will not be the case. I have sort of cleared up my schedule to do these pretty much every Friday, hopefully every Friday at noon p.m. Eastern time. The reason I bring that up, if you have subscribed to this channel, and I encourage you to subscribe to YouTube, click the bell to be notified whenever I'm on live. I do the Better Than Ever live shows on Tuesday and Thursday at noon. Sometimes I do shows at night about pro and college athletes and their injuries. But I have gotten overwhelmed with questions about people's medical conditions on shows and videos that's not what I'm talking about. And so what I've decided to do is make this the only time I do it. I don't answer questions in response to comments. I don't comments on the videos. I don't do it if you email me just asking for medical advice. I don't do it because one, as you're going to hear a couple times in this video, this is not meant for specific medical advice. This is general information and educational purposes only. That's what it's there for. So use it however you want, taking it to your doctor, something to know, but I am not telling you what to do. The second part of it is I've got other things I need to do. I've got a real job. I'm in the process of getting a third board certification in anti-aging and regenerative medicine, which takes a lot of time. And I just can't be answering hundreds and hundreds of questions every week. It's just not sustainable. Plus, I have recorded easily between written articles, recorded videos, and podcasts, there's probably 3,500 sports and exercise injury topics, orthopedic topics, and everything else between my website and YouTube especially, and my former podcast. So I can promise you I have answered every single question that I'm going to get today and that I ever get on my videos. The challenge is people, and myself included, we like to think we're special snowflakes, that somehow that information on a tibia fracture is different because you're a mechanic and not a carpenter. That kind of thing. Or you broke it playing basketball instead of soccer, but essentially the information is still the same. So if you can't make it here live, Fridays, 12 p.m. Eastern time, definitely check out my YouTube channel, search the channel on your topic, your injury, your surgery, whatever it is. Go to drdavidgeier.com and leave that as well. Noof says, we can see you. Yeah, you missed the very beginning. I don't know what happened. And maybe you could see me. I don't know. I couldn't see it in my monitor, so I don't know what that was. All right, so if you have questions, another thing I'd love for you to list your first name and where you are, whether it's a state in the United States or another country. I may have some things that I might give away for people that choose to do that. If you have questions, let me know. Like I say, I am here to answer your questions, but I am got a lot of things going on today. So if people don't have questions, I will not be here very long. I do want to answer a couple that I've gotten. And again, I said I'm only going to answer people that ask questions that are here live. That's true. So if you leave questions in the comments ahead of time, I'm not on YouTube. I'm on a platform called Restream that sends it out to YouTube, so I won't see it ahead of time. But there are a couple that I do want to answer. We got, I actually knew that. Noof was from, I I don't know if I should say Qatar or Qatar. I've heard it both ways, so definitely let me know that. Very cool. Neelam says he's from India. I know Jamie is from Michigan, and every time I seem to talk to Jamie, the weather's bad up there. I don't know. The U.S. is supposed to get a lot of bad weather coming up, so maybe that's coming again. All right, so one question I do want to answer, I got in yesterday's Better Than Ever Live, and if you like information and shows about health and wellness and better exercise and sleep and nutrition and things like that, definitely check those out Tuesdays and Thursdays at noon p.m. Eastern Time. But for somebody asked a question, and again, I'm going to start winding these down, but I did tell somebody yesterday I'd answer his question. I don't even know if he's here. Mansoor asked me a question about why his knee cracks or pops after a meniscus repair surgery. I can't say specifically in his case because obviously I'm not examining him and things like that, but there's a lot of reasons that your knee can crack or pop that may or may not be a big thing. Now, the meniscus, a handy dandy knee model here, is the C-shaped piece of cartilage. See if I can turn that in a way that everybody can see. This is one meniscus, that's the medial meniscus. This is the lateral meniscus, and if it's torn, it can catch between the femur and the tibia and cause a popping sensation or more of a catching or locking sensation. That's not typically the common thing. There can be arthritis, early breakdown of the articular cartilage lining on the ends of the bones, whether it's the end of the femur, the top of the tibia, the undersurface of the kneecap, or you could just have crepitus even though there's absolutely nothing structurally wrong in your knee. If you go find a girls' soccer team, high school soccer team, and you put your hand on their kneecap and have them bend their knee back and forth with your hand on it, you're going to feel about a third of them have this popping or grinding sensation. It's called crepitus, but if you stick a knee scope, an arthroscope in the knee, you will see absolutely nothing. And so popping, cracking is not something typically orthopedic surgeons worry that much about. But if it's causing a very significant pain with that popping, sometimes you go in and look for it or potentially get an MRI. But you can do a surgery. The knee looks completely normal when you go in and scope it. And even after that surgery, you still have popping. So again, not something we typically get terribly worried about. All right. Neelam, can water retention lead to pain in knee joints, ankle joints? Can we treat the retention naturally? So I hope this is what you're getting at. So, and Neelam, I really appreciate the question. The joint swelling that comes after an injury, you tear your ACL or tear a meniscus and maybe your knee swells in your ankle. Get my ankle model here. You get a sprained ankle and you get sort of a tearing of these ligaments on the outside of your ankle and the knee swells. That's a reaction of the joint lining that surrounds the joint. When it's inflamed due to trauma or whatever else, it makes a lot of joint fluid and it gets swollen. So that in itself can be painful because now you have the distension of the joint, and that joint lining is where a lot of the nerve endings are in the knee and in the ankle. This is true with other joints too. So now you've got this swelling sensation. It can be painful. That's why, even though I'm not a huge, for a lot of reasons that go beyond this answer, there's some problems with rest, ice compression, elevation, but that is one of the thoughts for all of that, is to get the joint swelling down, if for any reason, just to decrease the pain. Now you could argue that the ice vasoconstricts, sort of closes off the blood flow and the blood vessels to that area, so the healing cells aren't getting to that area. That's one of the people that criticize ice after injuries. That's one of the thoughts of it. But in terms of getting the joint swelling down, that is the thought. Let's see. Myofascial trigger point therapy. I am not 100% sure. That's sort of outside the world of orthopedics. Rafsal. I hope I'm saying that right. I will tell you that I am not as attuned. I think that's more in the world of the chiropractors and that kind of thing. I feel that there is a myofascial pain related to sort of adhesions and how the fascia, the lining or the envelope outside of the muscle sort of moves within the muscles. I'll be the first to tell you, I am not terribly attuned to most of that. As an orthopedic surgeon, that would be something that would not be something surgical, but I will look into it, and if I kind of come up with something, I will let you know. Neelam, you're so welcome. Thank you for that. Neelam, if you reach out to me, my website should be in the description below this video. If you go to the upper right corner on my homepage, there's a contact button or a work with me, and it drops down to contact. Send me a message, Neelam, and I'll send something that may help you out. Maybe not, but something from me. All right, Rafsal, you are very welcome. I appreciate it. I am guessing, and I don't know, between India and Qatar, and just looking at some of the names, we have some people that it's probably much later there than where it is here. So I very much appreciate you guys being here, because it's just hard. Whereas people here in the United States can sort of log on at work and act like they're working, put their headphones on and sort of watch this. They're not having to stay up in the middle of the night. So Grandpa says, always enjoy your videos. I appreciate that. I try my best. I am probably starting to do a little more. So I still do orthopedics, sports medicine, because I'm double board certified in those. So I still do videos on all orthopedic things, but I am branching out a little bit into some of the things that I'm studying as I get board certified in anti-aging and regenerative medicine. I've done videos recently on things like exosomes and peptides and PRP, which I've done for a long time. Some newer things out there, penisin polysulfate for arthritis and some other things. So definitely check those out if you have injuries, then you're thinking about sort of alternative treatments. I also want to answer a question I got, I guess last night, and I just, they wanted to come see me in the office, and that gets to, if you want to find an orthopedic surgeon, sports medicine specialist, but somebody that doesn't just say surgery or cortisone shots or physical therapy, but shows you all kinds of other treatments that you may or may not know about, I'm definitely happy to see you in either my Charlotte, North Carolina office or Charleston. So the information for that and how to contact me, like what I told Neelam, is in the description below this video. But it was a mom of a 15, 16-year-old who tore his ACL and had surgery, and they were looking for BPC and wondering whether or not that would be a way to heal faster. If you have not seen my video, or I talked about it in Better Than Ever Live, that's a peptide, which we could have a whole discussion about peptides, but short chain of amino acids. BPC 157 is naturally made in our stomachs, but it has been shown in animal studies, lots of animal studies, to have very good success rates for healing muscle, tendon, ligament injuries. It's been in human studies, albeit probably not the best designed human studies, to be effective injecting into knees with various causes of knee pain, arthritis, and meniscus tears and things like that. So that potentially could be helpful. Another one that I at least like to consider after somebody has a joint injury, not right before surgery because it's a blood thinner, you can't do that, but you could start it a few days after surgery, would be penisin polysulfate. So if you don't know much about that, that is a medication that's FDA approved for interstitial cystitis, which is a bladder condition, but it can be repurposed for osteoarthritis. It's been legal in Australia, I think, since 2016, and my understanding is they're having great success with it. It's in phase 3 trials with the NIH right now, so hopefully within the next few years it'll be approved here. Do statins cause joint pain? So what I have seen with statins, and if there's any other healthcare providers here that have thoughts on this, let me know. What I have seen is that patients that I've had that have been on statins, and I don't manage cholesterol and heart disease, so I'm not putting them on statins, I just get people with orthopedic problems, is they tend to have more muscle pain and muscle fatigue more than joint pain, but that could be related in the sense that we see this all the time after a knee injury, the quads shut down because of that knee swelling, like what they were asking, Neelam I think was asking earlier, where you get a big swollen knee that causes reflex inhibition of your quads, and then that in turn causes more knee pain because now your quads aren't firing effectively to take pressure off the knee. So that's something to think about there, that if the statins are causing muscle pain and they're not firing effectively, maybe that leads to more pain in the joint. Having said that, that is sort of theoretical in my mind. I have not seen studies on any of the statin drugs for shoulder pain, knee pain, hip pain, ankle pain, things like that, but it absolutely makes sense. Vitamins or supplements for joint pain? So this is a great question, and I'm going to give you the overview because each one of these I'd have to go kind of into a deep dive. So here are my thoughts generally when you're talking supplements and vitamins for joint pain. Far and away, the first one I'd start with is vitamin D. A huge percentage of the population is deficient in vitamin D. Minorities have more, don't absorb as much vitamin D from the sun, so that's a problem. We spend so much time these days indoors and not out in the sun, so we're not getting vitamin D that way. And a lot of the different foods we eat don't have a lot of vitamin D in it. So vitamin D would be one. It's not just for orthopedic issues, joint pain. It's good for muscle strength. It's good for athletic performance. It's good for bone density, but it's got a number of other health-related issues, virals and immune system functions, and so many other things. Vitamin D would be number one. Other things that I personally think are helpful. Curcumin, which is the active ingredient in turmeric, can decrease the inflammation and pain in osteoarthritis. It's been thought to slow the progression of osteoarthritis. Epigallocatechins, or EGCGs, which are found in green tea supplements. Green tea has EGCGs, epigallocatechins, just not very much of them. That's why the supplements can be a lot better. They block the inflammatory cytokines, interleukin-1 beta, tumor necrosis factor alpha, interleukin-6, the pro-inflammatory cytokines that not only cause tissue destruction, cartilage, bone themselves, but they recruit some of the degradative enzymes like matrix metalloprotease that break down articular cartilage. So I'm a big fan of EGCGs. Let's see. Those would kind of be where I would start with joint pain. We'll stop with that for now, but I'm sure there's others I can think of that would be helpful. Some people like spermidine. I don't have a lot of experience with that in terms of something I recommend to patients, but I have heard that can be very beneficial for bone and joint pain. Some people talk about melatonin, but not sort of traditional sleep dose melatonin. We're talking high dose melatonin. There's thought that might be good for arthritis and joint pain as well. So Mahmood says, parkour, I love that. That's very cool. I would love to be able, I wouldn't love to be able to do it, but I'd love to have the athletic ability to do it. Tibia fibula fracture, had the hardware removed. How long will it take to start doing the things that you normally do? Again, Mahmood, this is not medical advice. So this is meant for general information, educational purposes only. Take that for what it's worth. Typically, it depends a little bit on the hardware for a tibia and fibula fracture. If it's fixed with a rod down the center of the tibia and then you take that out, typically that doesn't take as long to heal, maybe 6 weeks where you take it out and then the bone gets stronger where it was. But usually with a tibial nail, the cortex, the outer lining of the bone is still intact, and that bears 90% or so of the weight. So that's usually not a big deal. If it's a plate and screws, you'd probably have to be a little more careful, maybe limited weight bearing, like partial weight bearing for 6 to maybe 12 weeks until those screw holes fill in. But again, that depends a little bit on how it's done. So that's why it makes it a little hard to say. Plus, there's a little bit of a difference between when a bone is healed on x-ray and when you can functionally do stuff. So that's where sometimes physical therapy can be good, progressing you through motion, progressing you through physical activities, things like that. Grandpa, you're so welcome. Very, very much appreciated. Okay, who else? That is Naiza. How can I reduce the stress in my throwing arm and kicking leg? All right, I'm not 100% sure what we're talking about stress-wise, but I'm going to answer that as if, it's funny, I just did a newspaper interview with a writer yesterday, and we were talking about youth baseball injuries and youth sports injuries, and we were talking about the repetitive stress on the shoulder and the elbow from repetitive throwing for long periods of time. And so I'm going to answer this as if this was a 15-year-old athlete, because it applies to 25-year-old Major League Baseball pitchers. It's not overdoing it, not pitching year-round or throwing year-round. It's not throwing too much in any one session. It's not throwing through pain. Things like that can be very, very important. Don't know if that's necessarily what you were getting at. So if it's not, definitely let me know as well. Mark says, anterior impingement of both ankles. It's painful, difficult to walk. Is there any non-surgical treatments to help? All right, so what he's talking about is, all right, get my little knee model here. And I'm going to show you from the front, tibia, fibula. You can see that, the small bone on the outside of the ankle. This is where are we here? Talus. Come on, David. That's the talus, the bone below the ankle, and the ankle joint right there. What happens when you get an impingement, now we'll look at it from the side, an anterior impingement, you get a little bit of scar tissue. I'm trying to do this and keep my finger out of the picture. You get a little bit of scar tissue in front of that ankle joint that limits motion, and it especially hurts with what we call, I don't think my model will do this, but dorsiflexion, bending the foot and ankle back. And the surgery, what Mark is getting at, is an arthroscopic procedure where you scope the ankle and you take a shaver and you just sort of clean out all the scar tissue. It looks like a little roto-rooter, a little vacuum in there doing that, and that can do really well. What some people like to try is a one-time cortisone shot into the ankle to decrease the scar tissue, to loosen it up, maybe make it not limit motion that much, not cause pain. I am not a huge fan of cortisone generally into joints for the cartilage breakdown reasons, but for a one-time thing, maybe that's a good option if you're trying to avoid surgery. Some people talk about physical therapy and joint manipulation and things like that. I don't know. It depends on how far advanced the impingement is as to how well that potentially goes. Mahmoud says it was a rod inside the tibia. Yeah, then typically it doesn't take too long, but again, it really depends on how healed that tibia fracture is. All right, who else? I am looking through my notes. I don't see anything else to answer. So I apologize for some of the technical issues earlier. I will change whatever this live stream is called. I'll change it and put it in the Ask Dr. Geier Live playlist. Remember, I will be here every Friday, noon Eastern time. I do appreciate you watching all my videos, and if you do leave comments asking questions, you'll see that I don't answer them there, and I'm going to direct you to do it here because this is my opportunity to do it. I spend 30 minutes once a week. This is when I'm going to do it. I can't be doing it all day long, but I am happy to help. It's not medical advice, but hopefully it's information that points you in the right direction. Also, next week, check out Better Than Ever Live on Tuesday. We're talking about intermittent fasting and weight loss. On Thursday, we're talking about the role of sleep and lack of sleep in your risk of injury in sports and exercise. And then we'll be right back here next Friday, 12 p.m. Eastern time. So that is all I've got for you today. Thank you so much for watching, and I will see you right back here on Tuesday. Take care.